welcome to our traditional Ask Julie Anything webinar. I am Mariana Nadai, and I will be your host today. And we're having our regular AJA. And for those who are new here, maybe you are like asking yourself, what does that mean? Like a regular AJA? So it means that today our co-founder and formulator, Julianne Lee, will answer all your questions about your beloved fur family. So if you have any questions about allergies, gut health, yeast, chronic diseases, or simply want the best for your animal, don't be shy and ask Julie anything. But before we start, I want to remind you about some housekeeping rules. Please switch your chat to everyone so we can all join in the conversations. Use the Q&A box below to ask your questions. Please don't put your questions in the chat because there's too much things happening there, so we cannot read there. So use the Q&A box. The questions will be answered in order, first come, first served, and we will do our best to cover as many questions as possible. And please keep your questions to ensure that everyone has a chance to participate, we will be taking one question per person. And please keep your questions brief so that as many people as possible can have their questions answered. So thank you for your understanding. And now the most important thing of all, this session provides a judgment-free space with only the health and happiness of our animals and the planet being our core goal. So without further ado, Julianne Lee, the floor is yours. Hi again.
Someone just asked that they don't know how to put a question on the Zoom screen. There's a little box on the bottom. It says Q&A.
Exactly. Yeah.
And you just go into that box and type in your question. Hopefully she figured that out.
So do you want me to start reading the questions or do you want to say anything to our audience?
No, yeah, and a regular AJA. Did you describe what a regular AJA is?
Yes, that people can ask any questions. Yes,
and
yes, I just forgot to say that be prepared because now we are opening the mic for some people when the question like sometimes
really long or something.
Really long or Julie needs more information without and like for her don't have to like keep asking you guys and then you guys like putting all the answers in the chat. I will open your mic and you can just start asking. So let's start it.
Okay, go ahead.
And the first one is actually a very big one from Abby Drew. Our cat is 11, neutered male. He's part Siamese, part ginger. He was diagnosed with IBD in March via ultrasound, I guess. He was on Zartac for years for histamine intolerance and itching. About a year ago, we tried to stop it, but when we did, the gastritis symptoms started. He was struggle with low appetite, nausea symptoms, and weight loss since last fall. He also tested high with ALT liver enzymes. We had to put him back on the Zartec last month to get him to eat. He's being treated with homeopathy. He's currently on a homemade diet. He also has histamine intolerance. He gets warm to the touch, has itching, most of his stomach and legs are bald, sneezing, and he gets cystitis with frequent urination. All urine analysis and blood work are normal for this. He also has attacks about once per month where he will suddenly howl and vomit, have a bowel movement, get really warm and itchy, and start peeing every few minutes, up to about 20 times in a day. For the rest of the day after these attacks, he eats. And then if you go a little down, you can see the continuation of the question. For the rest of the day after these attacks, he eats really well. There is no indication that he has mast cell tumors. We started with a tiny speck of your love bugs probiotic. However, when I very slowly increase it, his histamine symptoms warm to touch, itching, sneezing, and frequent urination decrease, but his gastritis and lack of appetite get worse. I also tried your liver tonic blend. I gave one single drop. He's very sensitive overall. The next day, the same thing happened. His histamine symptoms decreased, but he really struggled eating all day. This reaction also happens if I try to increase his histamine homeopathy in potency. When I increase the potency, all his histamine symptoms decrease, but he does not eat as well and his gastritis gets worse. I know that high histamine can cause gastritis symptoms. Therefore, I would have though that thought that as his histamine symptoms decrease, that his hepatite would improve. We want to reach out and see if you had any insight. It's such an interesting question considering all the conversations we are having this since last week about this topic.
I know. Um, so Abby, can you write in the chat, if you feel comfortable, who's treating this kitty with homeopathy? I wonder if they can do that. Oh, there we go. Oh, she's working with
I
the
am a homeopath.
Okay. Can I just, are you okay if I ask you some questions about remedies? Okay. Have you put him on carcinosin?
Do you want me to open her mic?
Maybe. It might be faster so that
Oh,
we aren't being in between.
Michelle, you have to do it. Let's wait to see her answer. He gets,
Activations with many remedies, including carcinosin. Okay, it would probably be better if I just talked to her, um, so that we can move through it faster.
I just have to show Michelle how to do it. Just a second.
Okay.
Maybe you can
Uh,
start talking and then.
I'm gonna try, yeah. So you're probably doing all of this stuff, but if I just feel weird if I don't ask these questions, are you doing like bell curves or are you doing potency cords at all? So for those people sitting here just listening, a bell curve or a potency cord is when you give a whole range of the potencies of remedies, and in some cases it does really help to decrease aggravations and things like that. So that's why I was wondering if she's already done that. Another question I would have, I did cords with him in the past and he did have an aggravation. Okay. Are you okay? We also have done LM and low potency. Are you completely opposed to giving combination remedies?
Hello, can you hear me?
Oh, hi. Yes, we can. Thanks.
Hi, Abby.
Hello, yes, so I went to the College of Practical Homeopathy. So it is not we're trained in classical, but we do a lot of combinations. So
Okay.
we definitely do combinations with him.
Okay. So you've done combinations like when I look at this and I'm listening to this, the first thing that I hear is that, so are you doing his IBD remedies and his histaminum at the same time, like in a combo?
So we have them all. I have a machine that I make them on, and we have them all in one pill that we give him twice a day. So he
So,
gets everything at once, and then he has a gastritis mix for acutes that he gets.
okay. Is Iris in any of those?
We tried Iris, and when we did, he had an aggravation. And generally, his aggravations are he gets very lethargic and his appetite plummets even more.
Okay. So interesting. Does your homeopathic veterinarian have him on quercetin?
We did quercetin in the past with him and we didn't notice any difference. We did like a nettle quercetin like combination herbally and we didn't notice a difference.
Okay. Such interesting symptoms. Have you just done a single dose of sulfur and no other combinations?
Yes, we did sulfur in the past, a single dose, and didn't really notice a lot of change.
Didn't notice a lot of change, but no aggravation on a single dose of sulfur?
To be honest, it was years ago. I don't
Oh,
completely remember. I'd have to go back to my notes, but I don't remember there being a huge aggravation with it. Yeah.
and how early?
There wasn't an aggravation where he got fatigued and stopped eating. I remember that.
Okay. So there's a couple things going on that just, I mean, I don't know, but just when I'm reading this, what I would try with him, because you were saying that the love bugs decreased his sort of hotness, itchiness, sort of the histamine stuff, but then he got nauseous and more of his gastritis stuff came up, right?
Correct.
Okay, have you tried the feline gut soothe?
We didn't. I was trying to start as simple as possible. And
Yeah,
in the past, when he has had the marshmallow root or the slippery elm, it
yeah.
causes his appetite to plummet. So I have that here, but we were starting with just the love bugs to try to take out any other variables.
Okay. Because what I think one nutraceutical that I think he needs, even if you just do that nutraceutical, um, would be uh, N-acetylglucosamine in fairly high doses. And I'm not going to tell you we won't aggravate on it because I don't know, but it's in our feline gut soothe and it's also in our easy peasy, right? So you could try feline gut soothe if he doesn't, if that doesn't seem to help, then you could try the easy peasy and you can return things, right? So if he aggravates on stuff, then you can return it. ABA will return it, right? If your animal can't tolerate it, even if he's unusually sensitive, it doesn't matter. If he can't tolerate it, we'll take it back. But because it is high levels of histamine, I would be pretty sure, and the way he's acting and how it's almost like he calms down. It's almost like the histamine keeps him elevated enough that he eats. Do you know what I mean? And then when he calms down, his gastritis, like, you're a homeopath, right? Like the philosophy is the body will only sort of handle and focus on one disease at a time. So, um, potentially, if his vital force is energetically focusing on this histamine because it's itchy and burning and then that calms down, then he calms down. And then sometimes gastritis issues can happen when the body's sort of vagus nerve calms down. Then you can actually have a gastritis release. But I think that he's probably got interstitial cystitis. I mean, I can't diagnose that, but it is one of the most painful things that any person or animal can have. And if he's having interstitial cystitis episodes, that pain will increase everything. It'll increase cortisol levels, it'll increase histamine levels, it'll increase it's a really nasty, nasty thing. And I bet you that's what he has. Because if he's having all of these sort of cystitis symptoms, but he's having sometimes they call it sterile cystitis, but basically what it is that the bladder wall becomes compromised. It's almost like leaky gut in the bladder. The integrity of the lining of the bladder wall gets very compromised, and the urine seeps into the lining of the bladder, and it just burns. It burns constantly. And it can be and it can cause them like to pull their hair out, self-mutilate, all kinds of stuff like that. So the thing that I have found uh that the thing that I've found the most that's almost curative, that I've seen almost be not almost, I've seen it be curative, is high levels of N-acetylglucosamine. And because it's a nutraceutical, it kind of doesn't have that, I'm not going to say as powerful, but sort of it doesn't have the herbal, it's a little more mild but intense. I don't even know how to describe it. But I would try to get N-acetylglucosamine into them. So if you can't take gut soothe, and you can't take and then you try the feline or the easy peasy powder. I would do the easy peasy powder and the liquid too. But if you can't handle the easy peasy powder either, then send both of it back and just go buy N-acetylglucosamine and ask your vet to look it up, and for his weight, give him the highest dose that you can of N-acetylglucosamine. And that'll also really, really help his IBD, because N-acetylglucosamine acts almost like glucosamine on the joint, only it's an anti-inflammatory for the smooth muscle of lungs, bladder walls, the lining of the gut. So anything mucosal, even like sinuses, things like that. So those would be the things that I would try. It wouldn't hurt to do another single dose of sulfur, I don't think, just to see, but don't do it at the same time as you're using a new product, like the feeling gut soother or anything like that. So I would try that. Those would be the things that I would try. And the last thing that I would recommend is have you done any kind of Bach flower remedies with him at all?
In the past, we have, yeah, especially like the 5-flower blend and things like that. Yeah.
And did he aggravate on that?
He didn't aggravate. We just didn't see any reaction at all.
But you might have to do both of them at the same time. I don't feel like they counteract each other. I've used Bach flower remedies with homeopathy lots and lots and lots, and we're really getting into plant stem cells. So, even like some of the lymphatic remedies, it's really hard to know what your kitty's going through, but one thing I feel very, very strong about is that you need to address the pain in his bladder, which will
Okay.
probably also address the pain in his bowel, right?
What, what
So
about what about the pea supplement? I had seen it on Dr. Judy's site. Are you familiar with that?
a pea supplement? No.
I'd have to look up and see what it stands for. It's a long name, but it's just PEA. It's shortened to, and they had recommended it for like mast cell for allergies for cystitis and things.
Yeah, I don't know. But I've clinically treated at my vet hospitals interstitial cystitis really effectively with
Okay.
N-acetylglucosamine.
Okay.
With all of the stuff that's actually in Easy Peasy, including that one probiotic that actually, even though there's no bacteria, it keeps its eye on bacteria, because if there's inflammation, sometimes it can grow. But it's been a lifesaver for more cats get it more than dogs do. And I'm sure you've tried Napmir with him.
Yep.
Yeah. So, if you've done Carcinosin, you've done Napmir, you've done Ignatia, sort of all of the strong emotional cat remedies. If you've done all that, I would put them on Bach flower and your homeopathics, and I would try really hard to get an acetylglucosamine into them.
Okay. Thank you so much for your time tonight. I really appreciate it.
No worries. Good luck.
Thank you.
Thank you for your question, Abby. The second question here is from Pat Herman, 7-year-old lab, raw fed for 6 years, Has history of seizures, controlled well naturally, daily MCT oil, phytosynergy, colostrum probiotic, 2 times a year liver tonic, 3 to 4 times a year rebalancer, various growth on left side, ski tag on ear, skin tag on shoulder, fell off, smooth wart like bump, left back thing, lymphoma on rib cage, less vaccine 3 years, always minimally vaccinated, but no more vaccines. The last few spring summers loses hair on his chest bone, not irritated, white skin. Oh gosh, Pat, I guess your question it's not full here and I cannot find
Trying
the
to look
rest
in
of it.
here. Are you looking for the rest of it?
Yeah, I can't find it.
You look while I mention something.
Okay,
Hopefully Pat can add it even in the
in
chat
the
so that it's
chat, yes.
um but Abby, I don't know if you're listening, but I'm really glad I read this next one because I wanted to say something. The other thing that would be really good for your kitty is CBD oil with no THC in it. So void of THC, and cats can tolerate pretty high levels of CBD oil if it's like 0.003% THC.
I'm checking if Pat is still
Oh, here it
here.
is, his chest bone right here.
Okay,
Put it in the thing. Okay, his chest bone not
not
irritated.
irritated, white skin and soft baby-like fuzz hair in the area. Seems to thicken and full in late fall in late fall and winter. Yearly full blood
What?
panel completed annually.
Okay,
Yes.
so 3 to 4 times a year rebalancer. He's on daily MCT oil, phytosynergy, colostrum probiotic, and liver tonic, and times a year rebalancer. Um, so various growths on his skin, tag, skin on his shoulder. So last few spring, summer loses his hair on his chest bone, not irritated. White skin and soft. Baby fuzz in the area seems to thicken and fill in late fall and winter. Is it itchy or does this is this just hair loss? Pat, if you could write that in would be great. If it's does his skin get itchy or does his hair just fall out?
Yeah, because the way that she described it seems just that is
It
falling.
almost sounds like um okay, why doesn't
It
she
does
jump?
seem to scratch, just
Oh,
seems to disappear.
just scratch, just
Doesn't.
doesn't.
Oh, okay. Doesn't
Is
seem to
there
scratch,
is
just
there
seems to disappear.
anything is there anything different in the spring and summer that he lies on that he doesn't lie on that goes away sort of in the fall and winter when it cools down? Like, is he lying under a specific tree because it's hot that has different kinds of grass? Do you put a cool bed out for him to lie on in the summertime? Is there anything different that he would potentially be lying on his chest with?
It
He
does
does.
lay flat on the hard floors, where in colder months he lays on a bed or a couch.
Ouch, yeah.
Maybe some product that,
Is on your floors,
yeah.
which you potentially wash the floors with, or even what the floors are made out of. I wonder if there's a way that you could get like some cotton sheets so that the coolness of the floor still comes through, but there's a barrier between just as a test, but there's a barrier between the what he's putting his chest on and the cotton sheet and the floor. I would do that. First of all, I would do that like right away. And the other thing is, I mean, if his blood panel is coming back normal, but I have seen, but that wouldn't make sense if it's just in the summertime. It sounds like a seasonal allergy, or, but it sounds more like a contact allergy. Because if it's just there, that's much more uh that's much more like a contact thing that he's having an issue with than it is like a pollen. If it was a pollen or a particular dust mite that comes alive in the warmer weather, you would think that it would be like more in his ears or maybe around his mouth or underneath his armpits or between his groin or you'd see it a little bit more than just on his chest.
Hmm.
That's what I would try doing this year is doing that and seeing if it makes a difference. The other thing is if it is some kind of a imbalance, you could do both. You could do our vital defense. You could put him on vital defense so that he's getting, because what he's not getting is he's not getting any kind of mushrooms, which is massively important for allergies. But you could put him on a one container of vital defense and lay out, try to encourage him to lie on 100% cotton sheets if you can put them around a little bit for him and see if that helps this year.
I was looking for the link, the vital defense link to put here in the chat.
Maybe, oh, there we go.
Okay, thanks, Julie.
Always welcome.
So the next question is from Kathy, and it's like a very long question. So, guys, I will read this, but just remind to keep the questions like a little shorter. So, thanks for your webinar. The question is: my dog GERD is worse from 9 to 10 p.m. to 2 to 3
So
hours.
GERD is
The
the condition.
Oh, sorry, my dog GERD.
It's probably, I think, it's probably is saying my dog's GERD is
Yeah.
worse from 9 to 10.
So yeah, the condition is worse from 9 to 10, 9, 10 p.m. to 2, 3 a.m. And now he absolutely need to eat every 90, 120 minutes during those hours to be okay. In the days he does not show GERD symptoms. What's different at night? What can be done? Did not improve with melatonin and 3 mg. Oh, there's some side questions. Are the saliva food intolerance tests working? There's the background info. 3 years old Caribbean stray whipped mix adopted 2 years ago in Canada, 42 pounds, was on commercial raw diet and kibbles. Issues started slowly late last summer. Poops were always good. Problem was vomiting. Vet said acidity problem fixed with food. Kibbles were ditched. Worked with a nutritionist for home cooking. He showed intolerance to almost everything. Improved with antibiotics. Was bite by a coyote. He chased probiotics, FMT pills, but he was never great and it never lasts. Appetite is almost good, not drinking enough for the last few months. A recent ultrasound showed a mild gastritis and mild chronic enteropathy. Food intolerances suspected. Other organs were normal except for a known issue cyst on left kidney. Blood work normal except for very low folate. B12 was at maximum upper normal limit. Reacted reacted react badly to prescribed HP canned food. Drugs help a little, but not great. Omeprazole 10 mg daily and sucrate as needed. Did not tolerate prednisone, Pepcid AC. Gabapentin, sorry, did nothing. Now food is just poached, cooked beef, 10% fat, drained. Nowadays, poop only once every 24 to 48 hours. He just did a month of East Beats protocol, had a rapid detox at the beginning, even with slow introduction, and now transitioning to leak gut protocol. Since mid-April on the homeopathy mix for IBD, SIBO minus arsenicum worsen. From Ask Julie Anything April IBD special. He receives monthly combined osteopathic acupuncture TX. He put back his weight in the last 2 months, but health still average.
Okay, get her on the
Wow.
mic, please, because I have too many questions.
Okay, let me get her full
So the
name.
first question, Kathy, until you can get your mic organized, is when you put him on the remedies for IBD slash SIBO minus the arsenicum, is that, so that was in April, right? Since mid-April on homeopathy, so April, May, June. Is it since the homeopathy it was a really important question. Do you think he's gaining his weight when he's been on that mixture for IBD and SIBO? Hopefully she'll be there. And if you can't get the mic working, you can just put it in the chat. Not sure he ate a lot. Okay. So
Hello?
Hi.
hi. So, I mean, when I'm reading this, especially with his B12, like very low folate, B12 was the at the maximum upper limit, but low folate. Like the fact that he got better, it was sort of like not an intentional antibiotics, right? He went on antibiotics because he got bit by a coyote,
That's right.
but his symptoms improved on the antibiotics.
Yes.
Okay.
They improve, but you had to do a second course like 10 days after, and then the symptom didn't improve on the second course of antibiotic.
Yeah, probably because it's not the right one. It probably helped a little bit, but then I would still be working. Like I'm not going to say that your dog has SIBO. Like I can't say that. There are tests that vets can do now to actually 100% confirm SIBO that you might want to ask to have done. But the I would put him on our soil and sea probiotic. I formulated that product for SIBO, specifically for SIBO.
So
So,
I'm in the leaky gut protocol right now.
okay,
Should I also give the soil and sea or do that after the leaky gut?
how's he doing on the leaky gut?
I just started, and it's been 4 days since I gave him the full dose of gut suit. I didn't put
Enzyme?
the enzyme yet, and
Good,
I think it's getting better because last night he just woke me once for eating it.
awesome. Okay, so this is the other thing you can do. Don't use the enzyme. Um, we'll figure out how to maybe return it for you or whatever, but I would not be putting this dog anytime soon on any kind of enzymes.
Okay.
But the rest of the stuff in the leaky gut protocol will be really helpful. The other thing you can do is in that 9 o'clock time. So are you giving gut soothe once a day or twice a day?
I was giving once today, but I was wondering if I should give him more because he wakes up in the morning, and I gave him at 9 at night at about 7 p.m.
Yeah.
And in the morning is fine, and as the day goes, he's getting worse and worse.
Okay. So it's different now, right? So he's better when you give him the gut soothe, but then he starts to have it then in the morning now.
Well, it doesn't have GERD in the day at all. It's just kind of at night, but all the other symptoms that he has about 20 symptoms per day. So in the morning, he's usually really fine, and then it goes down to the day and it worsened. And then at night, he got also the GERDs that happen.
So what's his symptoms during the day?
He will be asking for food a lot, and
Okay.
then he would be lethargic, doesn't eat, doesn't drink. He has a bad smell, a bad breath. He
Yeah.
would burp, fart, sometimes eating grass. You can see pain in his eyes, nose,
Yeah,
lethargic.
He's so classic of SIBO. It's crazy.
He
Um,
got muscle twitching, pain in the back, the feet, the leg, pain before going to poop. He's shy to
muscle pain.
touch. What?
Muscle pain, did you say?
Yeah, a little bit of muscle pain, mainly the back. And then when he's got really bad digestion, you can see the vertebrae on the back that kind of stick out.
Okay, and you are giving him that remedy, Iris?
Yes, Iris, yes, yeah.
How often are you giving him the remedies?
3 times a day.
You can give him those remedies every couple of hours.
Okay.
When he's symptomatic, you can just go ahead and give it to him for now. The
Okay.
other thing you can do is he's a 3 year old, he's 3 years old.
Yeah.
Uh 42 pounds. Oh my God, whippets. I know. See the one behind me?
Yeah, I know.
She had really, really, really bad IBD and chronic pancreatitis. So when I rescued her, and I used to put gut soothe. I used to mix a jar of gut soothe up and have a syringe, and I would mix it. Can he tolerate raw goat milk at all?
I'm not sure. When I was doing the leaky gut, I was giving the produce and gut meal. At first, it was fine, and towards the end, just after taking it, he was having muscle shaking a lot.
Okay.
So
Wow.
I switched to bone broth, and he seems fine.
Okay, so you can mix the gut soothe and bone broth for sure. And you could mix quite a bit of it, right? Like you could put like double the dose of what it recommends for 42 pounds, at least double the dose. And then you can mix it in the bone broth and you can give him his normal amount, like you would normally do in his food or however you're doing it at night. And then in the morning, when you can give it to him again when he eats, or you can give it to him by syringe prior to him eating, right?
Okay.
Or if he likes it, you can just give it to him and let him lick it up from a bowl.
Yeah,
Uh,
he likes it, and he eats 5 times a day.
okay, so you can, I would personally try to give it to him like about 20 minutes, 15, 20 minutes before you feed him, just so that it sort of can help coat things and calm things down before he even eats. And
Okay.
then I would give him probably his homeopathic remedy around that same time as well. The other thing, but I don't know the dose, you can call customer service um, and just remind them to for me or send them your email. I'll try to find the dose for you. What's really, really good for GERD and for acid reflux and all that is something called meadowsweet. It's an herb, but I have to make sure 1,000,000% that it's fine. I gave it to my dog all the time, but I did lots of things with I do lots of things with my animals that I can't. I'd have to look it up for you to see exactly how much that they can have and if it's safe and that sort of stuff. So don't give it until I can find that out for you.
Okay.
But it's a lifesaver as well. It's really, really good. But definitely, in this you're giving it CBD already, or you're giving it MCT?
I don't give him CBD.
You don't give them CBD.
No.
You can give him CBD for sure. Like CBD with like organic full spectrum CBD but with no THC. So or 0.003% THC max. Where do you live?
In Montreal.
In Montreal. You should be able to get it.
Okay.
So you can start off, I mean, you can get a dog one for sure. But make sure it's strong enough. Like don't just go get a inexpensive one that hardly has any milligrams of it in. Um, so do those three things. Get the CBD oil, mix up the gut, mix up the gut soothe in a container and then put it in the fridge once you've mixed it up. And then give that to him along with his remedies 15 minutes prior to feeding him, so 5 times a day, and the CBD oil. And if you want to get that test done to confirm SIBO, and then continue with the leaky gut protocol for now. If he starts to decline, let customer service know. And then I would probably switch to Soil and Sea, but I would continue to give the homeopathic remedy in that's called Gut Seal.
Yeah, okay.
Keep giving that through the whole entire thing.
And and the CBD, do I give that once, twice? How many quantity? I'm not familiar with the.
I would give it to him I would follow the instructions because it's all different. Follow the instructions, but 100% make sure there's no THC in it.
Okay.
Okay.
And the saliva test for food intolerance, are they working? Are they doing? Do you have any brand recommendation?
Yeah, I mean, Jean Dodds has a good one. Dr. Jean Dodds, if maybe Emily can put it in the chat, so that you can do it yourself, you know. She's really, really good. You could do the food intolerance and kind of try and, stay away from things that he could be reactive to. That does help as well. But I really believe that the gut soothe, the CBD oil, the homeopathic remedies, I'll look up the Meadow Sweet for you. And I think you'll probably see a difference with that.
Hopefully. Thank you for your time.
Okay, no worries.
Thank you, Kathy. Here, question from Ansky Williams. Sorry if I didn't pronounce your name correctly. What can we do to protect our dogs from systemic flea and tick protection?
Ansky, can you write in the chat where you live? Because it's different in every country.
Let's see. In Ansky.
If you're in
Western Oregon, I guess, USA.
so USA, that's good. So if you have a really bad flea and tick problem, there's some people that love it, some people that, there's when it comes to fleas and ticks, there's not a ton you can do. Rita Hogan, she's a canine herbalist. She has some she has actually a flea course that you can take, how to make sure that you don't get flea infestations. It's great. I would suggest doing that, like going on her website and taking a look at that. And I think it's just she's called the Canine Herbalist. And then there is Wonderside. It's pretty intense. It's quite strong. So I always tell people to slow down and rather than fleas. Oh, it's ticks rather than fleas. Yeah. So Wonderside supposedly alleviates ticks altogether, like the ticks won't land on them. But there's another one called Sustenance Herbs. So, and you can get that in the US. Can you guys put that in too? We have that Sustenance Herbs website. She's really good. she knows a lot about ticks, um and yeah, Wondercide is great. Sustenance herbs is interesting though, it's internal. So what's great about it is that if the Wondercide doesn't prevent the tick biting, the herbs that she makes helps to like literally change the dynamic where the actual bacteria and virus can't attack the cells. So it helps to derail Lyme or anaplasmosis. He contacted Anaplasma platy when we were using an herbal spray religiously. Yeah, yeah. So they're really great. Just contact them, and they have two. They have one called Anaplasma No, and then they have another one called Burrell Immune. So the Burrell Immune is the one that you start giving your dog, or that you can't give it to cats, but dog or horse, and you start giving it to them prior to tick season. And that's the one that if they get bit, it derails it. And the Anaplasma No is if they actually have anaplasma to give it to them. So I would recommend contacting them as well.
Amazing.
So you can do a double whammy. You can put it on them topically, and you can put it on them, give it to them internally. Like give the Wondercide do the Wondercide topically and the sustenance herbs internally.
Thank you. Cherry Dobbs is asking, my dog has low.
So hold on one
Oh,
second.
sorry.
Kate said I've tried Wondercide and one of my cats had a reaction, started foaming. So did I. The same thing happened to one of my cats. I'm really, really careful with it around my cats. What I normally do, I don't use the one with a lot of cedar. The cedar oil, I think, is what affects them the most, but you have to be really careful with cats. Cats are very different than dogs. So, what I did when I was really worried is I would lift up the couches, my couch cushions, and I would spray it under my couch cushions. So I used it externally rather than putting it on my cat. And that seemed to be
Interesting.
okay.
Nice. Okay, so Cherry is asking, my dog has low thyroid, bad skin and cells in his urine, going to go on antibiotics. What should I be doing to help him, especially if he is on antibiotics for a longer period of time?
And cells in his urine, bacteria in his urine, or can you tell me what kind of cells are in his urine
Yeah, it
potentially?
makes more sense to be
So
bacteria.
bacteria,
Bacteria, yes.
bacteria. Okay. So that's fairly common. When they have low thyroid, their immune system seems to be really sluggish. Things that can help, there's lots of things that can help thyroid, support this, like support the thyroid. So our phytosynergy is really good for supporting thyroid because of the amino acids in it. There is a company called Standard Process. They have a natural thyroid supplement for low thyroid. That's really, really helpful. And as far as his urine goes, our product called Easy Peasy is really, really, really helpful for chronic urinary tract infections. Very, very helpful. It's specifically to try and change the acidity so that bacteria isn't having a fun time in there. It has a specific probiotic that actually attracts the bacteria to it, adheres to it, and then they when they urinate, the bacteria passes out. So I would definitely do that. Any kind, so if he's going on antibiotics, you just have to remember that you're going to use probiotics, that you should do it 6 hours after the antibiotics or 6 hours in between the antibiotics. But definitely, I would definitely recommend the phytosynergy for sure, and the easy peasy powder. You could even do the easy peasy protocol. Definitely wouldn't hurt. It's got a homeopathic remedy in there that supports the kidneys and the bladder. He's on Phyto daily. That's good. That is good. That's excellent actually. If he's on Phyto daily, his kidneys are fine though, I would imagine. Hopefully, I have easy peasy on hand. Great. Um, uh, doesn't have any crystals in his urine or kidney issues, Sherry? No kidney issues or crystal issues. She didn't say that. Okay, well, find out if there's no issues with your pup's kidneys and at all, if its kidney values are normal and there's no crystals in his urine. You may he's 11. Yeah, I mean, you could also do you know what? You could do turkey tail instead of doing I was gonna say uh you could do our vital defense if you wanted to do our vital defense and alternate it with phytosynergy.
He
So one
gets
day,
turkey tail already.
oh, he gets turkey tail already.
Yeah.
So he doesn't get the chaga, and also the chlorella is also really really helpful for thyroid. But honestly, I think you said you have the easy peasy on hand.
She
Definitely,
said
definitely
yes.
go ahead and start it for
Yeah.
sure. Go ahead and
And you
start it.
mentioned chaga and the phytoplankton, and she mentioned yes, he does. So I don't know if she has both or
Say, yes, he does. He gets turkey tail. He gets
chaga.
chopped. Okay, good. That's fine. That's awesome. So just you can always increase phytosynergy. I don't worry about like overdosing them on phytosynergy. I'm not gonna say like really, really overdose them, but instead of doing phytosynergy once a day, you can 100% do it 2 to 3 times a day, just to support his immune system for sure. But really, I think you're going to be surprised using the easy peasy.
Amazing. Thank you. Julie Claire. Oh, have you heard of Unda 1000 for
Yeah,
thyroid?
and they're like they're sort of like a combination of homeopathics and plant stem cell. So yes, I have, and it's good. It is good. Yep.
Amazing. Great. Claire is asking here, my 2-year-old German Shepherd has GERD. Recommended treatment. She's on budesonide, sorry, Happy Earth, Prilosec, half dose daily. Please advise.
Okay, well, hopefully she heard
Everything you said.
everything I said about GERD with the question about GERD before. I would recommend you go on YouTube, and we did an IBD. It was the IBD one she was talking about, wasn't it? The IBD lecture that I did.
I
I think
can
so.
take a look very fast here.
I'm pretty sure that that's the one
Yes,
that she
it
was
was.
recommending. Yeah, so we have an IBD lecture
Let me
that
get it.
also incorporates GERD. I definitely would recommend that you watch that. There's all kinds of tangible tools that you can use. And our gut soothe is excellent for that. And we don't make or carry uh, CBD oil, but CBD oil is really helpful for GERD. Looking at so long as it doesn't have THC in it, and looking at low histamine foods, right? So not a lot of fermented foods. So not a lot of not a lot of fermented goat milk and not a lot of kefir and not a lot of like straight raw goat milk is fine, but the minute that you ferment it, it increases histamine, and histamine is one of the worst things for GERD. It can be really um, activate GERD.
Amazing. Thank you, Julie. Michelle, I don't know. It's asking 16 years old, spayed female shepherd, Shauchi, something cross 40 pounds for over age on raw store pre-made rotating protein since about October 24th. Not interested in raw any longer. First warmed up food, bones not included, was okay first, then switched to smack and now carnivore after she refused to eat slowly warmed up raw. On pre and probiotics, free fish oil and jump for joints, all from ABA. PEA from Dr. Judy Morgan, Glycoflex, Lumbrax, and Halcyon Gold Standard Herbs, Lumbrax and Halcyon administered by syringe. Has backhand weakness, does something that splits, does sometimes the splits, hard times to eating standing, will eat when I support her back legs or on a harness with handle, teeth, doggy toothpaste and Liba tree spray. Problems we have on and off soft runny stool, teeth losing battle no longer purely white has built up, pain in back, arthritis never officially confirmed, veterinary suggested Librela. I said no. Last vet visit March 25th, ALP 512, BUN 14.9. Other than those, no red flags in her test results. All supplements have the raw food questions. Help with pain management, teeth, raw food. Want to get back to raw? Best way, warm up food. Would this trigger pancreatitis? Do the warm up fat? I'm guessing the carna smack food is causing the soft stool. She used it to eat twice a day, but due to the fact that she was not hungry in the morning, now she gets her meal around 6 p.m. Would this cause fainting and washroom runs during the night? Is one or two meals better? Is one or two meals better? One meal better in the AM.
I just want to see if he has anything else. I don't think so, right?
I'm checking.
Okay. All right. Well, you know what? The whole not wanting to eat raw when they're she's 16, right? Is that what you said?
16, yes.
16, yeah. Um, it's so normal. I can't even tell you. I cannot even tell you how normal it is for them to go off raw. I sometimes wonder if it's because they start to lose their senses, right? So they start when they get older, they start to lose their sense of smell, they start to lose a little bit their sense of taste. So they need to like be enhanced to eat, you know. I you're probably gonna be dealing with soft poops unless you can definitely put her on gut soothe, right? So if you're back and forth with trying different foods, and we know, okay, she's been on raw food for 8 years, so doing all these different foods, she's gonna potentially have an upset stomach. That's understandable. So you could try gut soothe to see if that helps to alleviate that, which it possibly could. Now, when it comes to her food, I've had patients at my clinic that you have to start looking at their quality of life too, right? Like eating for an animal is pretty important. Like it's a pretty big special time in their day. I think it's an important time for their mental health to be excited about their food, to want to eat. So there's a couple things. I don't know whether you've tried uh, freeze dried and really, really soaking it with hot water, like boil the kettle, chop up the freeze dried really, really well. Um, Pour the hot water on, pour it right over top and let it sit. Put a plate on top of the bowl and let it sit and suck in all the water so that it's really, really soft. And then crumble it. My dog, when he was getting old and wasn't feeling well, loved it. Totally, totally loved it. You know, sometimes what you have to do is bite the bullet a little bit. I've actually seen, and I know so many people right now are gonna roll their eyes and think it's like blasphemy, but I've seen, you know, buying sprouted sprouted grain, like sprouted bread, and so I'm like 100% sure it's organic and sprouted, and making them toast and giving them small pieces of toast prior to their food. It kind of starts the whole salivation and intent and interest in eating. I did that a lot. People just thought I was insane. I did a lot with my cancer patients at my clinics. I would just say feed them toast. They've got to eat, so feed them toast. If they want to eat toast, feed them porridge. If they want to eat porridge, it's just sort of like a self-stimulation, and then feed them something that's better along with it. So, you know, you can try doing some stuff like that. Uh, as far as her back goes, I don't know what you're giving as far as the jump for joints, but you can give her jump for joints 4 or 5 times a day. You don't have to just give it to her once or twice a day or even 3 times a day. You can definitely give her jump for joints, you know, 4 to 5 times a day. The other thing that I would try again is CBD oil for sure. I know I'm talking about CBD oil a lot tonight, but it is really good for pain and it's also really good to enhance their appetite. Just make sure it doesn't have THC in it. So again, organic, full spectrum, less than 0.003% THC. You can try that. And I think that the other thing that I was gonna suggest too is one of our products called Go To. So sometimes like my old dogs or some of the dogs that I saw in my practice that was either really old or had cancer, uh, I got them to get a yoga mat and put quite a bit of padding on the yoga mat and try to get their dogs to lie down and eat and put their food on a completely flat plate, no bowls at all. Make sure their water bowl's raised with a back like that so that she doesn't have to bend over to drink. But you're probably doing all of that stuff. And but if she can get comfortable eating lying down, that might make a big difference as well. It's very natural. Like animals in the wild eat lying down all the time. Like so wolves and coyotes and the foxes, when they kill a prey, they lie down often and eat. So maybe you could get her comfortable lying down. Um, you know, it sounds like her ALP and BUN. I don't know if you're on liver tonic, but if her ALP and BUN is elevated a little bit, that's her liver and her kidneys. So I would definitely get her on liver tonic because it supports the liver and the kidneys, and sometimes that can make them feel a little better that they want to eat. And so gut soothe to help with the changes in diet and trying to get her stimulated in the soft poops. You could do, you know, gut soothe twice a day easily. Some CBD oil, the remedy called Go To. Do that, you know, 3 or 4 times a day. Um, see if you can get her to lie down and eat. And try her on some dehydrated food, well soaked, bone broth, and toast and porridge, things like that. Porridge with some raw goat milk on it, you know, really, really good organic, well soaked porridge, with some raw goat milk. She might like that. She's 16. Just try to put yourself in a position where you have, a 90-year-old grandmother, and they're it's amazing what dogs can continue to thrive on, so long as their mental state is better, their pain level is lower, and yes, perfect world, she would be continuing to eat raw, but she has to eat. Someone add lotus raw beef green tripe. Yeah, that green tripe is really, really good. Um, uh, and it's stinky and smelly, and sometimes that's really good and also could help with her stomach. You just have to try different things, and so long as you keep it very clean, organic, and if you do use anything grain related, make sure it's sprouted. Make sure all the grain is sprouted.
Great, thanks, Julie. And Jamila is asking, hello, our 7 years old English Springer Spaniel has recently been diagnosed with rectal tumor. We have started giving her a few of ABA products based on the recommendations. The products are Liver Tonic, Phytos Flora, Turkey Tail, and Vital Defense. I have a question. How many drops of the Turkey Tail could we give her on top of the recommended dosage? She weighs 35 pounds, so we have been giving her 35 drops. Also, are there any other of our products you would recommend? We also giving her nitric acid 200C, so we are hoping for the best. Thank you.
Yeah, nitric acid. Okay, so as far as the turkey tail goes, you could add a quarter more to that. So instead of 35 drops, you could, what's a quarter? What's a quarter more? So 15, you could do 40, 45, 50, like 52 drops. You could give her 52 drops, see how she does on 52 drops. And if she's doing fine on 52 drops, you can also increase it a little bit more. You just have to, do it really slow. Watch how she reacts to it. I don't see there being a problem, but we always recommend or talk to your veterinarian, see about that. What they would recommend too, because a veterinarian can actually give you a therapeutic dose of turkey tail, let you know what the therapeutic dose would be, which is, probably double, but it would be good to ask. Like, I'm not working with this dog, so you could ask your vet if you could double it. They would know that. Nitric acid is excellent. It's a really, really good one for rectal tumors. So is Thuja. So Thuja. Thuja 200C is very good for rectal tumors, and so is carcinosin. So there's a homeopathic remedy called carcinosin, and I don't know if you're doing nitric acid every day or not, or even a few times a day. I would be doing it a few times a day. I'm not sure if you listened to my conversation with the homeopath that was talking about her cat. It was a cat, wasn't it? Yes, it was a cat. And we were talking about a potency cord. So you could take nitric acid, unless you're working with a veterinarian. We just gave it twice a day for now. So you could go and get nitric acid 12C, 30C, and 200C and mix them all together. And you could give that easily 3 times a day. like just continue it 3 times a day. And you could do the same thing with Thuya. You could get Thuya 12C, 30C, 200C, and give it along with the nitric acid 3 times a day. And carcinosin 30C, what you can do is you can give a single dose or just 3 doses in one day. So sort of like when he wakes up in the morning, in the afternoon, and then before bed. But you only do that once a week. You don't continue doing that every single day. So the carcinosin is sort of like a booster remedy that they just get once a week along with the very pathological remedies. So I would do that. And everything that you're on from us is great, like the Vital Defense. The only thing that I would consider is maybe also doing some, I don't know whether this tumor hurts when they defecate or not, but if the tumor's painful at all, which it might be, doesn't make that's why you're using nitric acid too, I would start Go-To, which is our arnica and aconite combination. And I would give that 3 times a day as well. The arnica is a really good, acts like a really good homeopathic anti-inflammatory to decrease any kind of swelling. Because if it's rectal, when they go to the bathroom, when they have a bowel movement, then sometimes it can tear the skin around it, or it can make it inflamed, or it can make the other area of the lining, the mucosal lining inflamed. So the arnica and aconite can really help that as well. And I don't know, liver tonic, Phytophthora turkey. It also wouldn't hurt to have some gut soothe in there, even if you only did it, every second day, every third day. The N-acetylglucosamine and the marshmallow root and will help to take the inflammation out of the lining. So not the tumor itself, but if the lining of the rectum is inflamed because of this tumor, then that can help to decrease the inflammation.
Great, thanks. Oh, she's asking if can we combine gut soothe with Phyto?
Yes, you can.
Okay, thanks, Julie. Rachel is asking here, I have a Shih Tzu who has had vaccinosis. I spoke with staff at the global show and she suggested Rebalancer for 10 days. I did do that and her naughty behavior is better, but she's still really itchy. She does not have any visible skin issues and I do feed her a gently cooked diet based on her food intolerances. I started Phytophthora after the Rebalancer.
Okay, well then you can do, if naughty behavior is better, it's almost harder to shift a personality change when it comes to vaccinosis than anything else. So what I would do if that has happened, so there was a shift with her naughty behavior, I would do another 10 days of it. And then what I would do is I would do it 3 times a day, once a week for a month. So do another 10 days, see how it goes, and then I would do it, if you finish on a Friday, then the next Friday do it 3 times a day, and then the next Friday do it 3 times a day. So do it once a week for a month and see how that goes.
Perfect, thank you. Donna is asking, my dog has a blood transition due to PIMA anemia. He's on cyclosporine and prednisone 2 months now. His RBC count is around 20. Any suggestions that can help? He just started Vital Defense. What do you think about FMT fecal microbiota transplantation? Thank you for doing this. Thank you for your question, Donna.
That's great that you started Vital Defense. I would actually do blood transfusion. You know what I would do? I would do Vital Defense, and I would also do our Wolf. And what do I think about FMT? I think FMT is great. I do. I have no issue. I think it can, it can create miracles in some animals, but you have to be if you're going to do FMT, I would be doing it with a veterinarian that is really, really, really well versed because um, the fact that he's on an immune suppressive drug and he's on an immune suppressive drug for a pretty intense disease. So you just wouldn't want, so this what when you get a transplant, what any kind of transplant, so a heart transplant or they will put you on prednisone, right? So that your body doesn't reject it. But your dog is on prednisone because it's focusing on suppressing the autoimmune response of this anemia and a blood transfusion. So he's already getting a transplant of someone else's blood. I feel that to get a transplant from a fecal transplant now, from another dog, it just might be too much. If it was my dog, I wouldn't do an FMT, not right now. But you can talk to, there's a lot of veterinarians that really, really specialize it that have been doing this for a very, very long time, and are really well versed in it. You could talk to them and see what they would recommend or what they would say. I would be I would be a little nervous of doing it when his body's already trying to transition and not reject the blood transfusion. So if it was my dog, I wouldn't do it, but then I'm not an FMT expert or specialist, so I would definitely uh, go to a veterinarian. If you're going to do that, I would go to a veterinarian to do that. The other thing that you can do is is add the wolf in because of the immune modulation perspective of that probiotic.
I think I'm going for the last question, if it's okay, because it's getting late. Let's see
Yeah.
how long you take to answer this one, and then if you have more time, then we can have maybe another one. So it's a question from Cara. My dog Cassie has IBD, and we are working with a nutritionist. We have done the East protocol and the leaky gut protocol. She has also lost weight since getting back on the raw diet. Turkey. One, is it normal? Two, she still licks her paws and even the furniture during the allergy season, pollen, mold, etc. What else can I do for her? Thank you.
Well, Phyto synergy was tested, there was a research that went um, on at the Moncton University with IBD. So phytosynergy is really, really good because it's got a lot of nutritional value that doesn't have to be digested. So when the gut is inflamed and when it's had IBD or has IBD, it has thickening. So where that thickening is, the body has a very hard time absorbing nutrition. So when that's the case, then what can happen is that they get very, very they lose weight because they just don't have a lot of uh, ability to absorb their nutrient value. So I would definitely put this puppy on Phytosynergy, or you could also try Vital Defense, right? You could, because of the phytosynergy in the phytoplankton um, in Vital Defense, and then the chaga uh, can also help with the immune system. But if you want to just try for now, like leaving her on the leaky gut protocol for a little bit, especially if she still licks her paws in the furniture sometimes in allergy season. Usually that can also mean that the histamine level is high from the allergy, and it's causing an acid reflux. So once you're finished the leaky gut protocol, if you wanted to keep her on the gut soothe, would probably be a good idea, and either add the Vital Defense or add phytosynergy. As soon as yes, she licks her paws as soon as she starts eating too. Have you done a Jean Dodds saliva test? That would be something that you might really want to do. And that way, um, you know what foods to eliminate that she's sensitive to.
She
Because if she's licking her paws as soon as she eats, that could very well notice a food allergy test. Yeah. Well, the saliva test, you can do it at home. I know the um I know that Mariana, you put it in the Gene Dog, someone put it in the chat, right? If they want to just throw it quickly in the chat again. That saliva test is excellent. And you do it at home and you send it in, and they'll tell you what foods. I really believe in that one. Um, I don't believe in all of the allergy tests, but Gene Dodds is a really, really good test.
she mentioned before, sorry, I'm just trying to find here. There's so many.
There it
Okay.
is. She got it.
And she said before that she's wondering about SIBO now.
Yeah, definitely. So your other option is when you're finished the leaky gut protocol, you could start her on Soil and Sea. You could also go back and watch the IBD one that we were talking about. There's so much information in that lecture of how to navigate IBD. That probably would be really helpful for you. And yeah, that's definitely, I can see her spine. Yeah. Yeah. So she's not absorbing her food, I guess her bowel thickening is probably probably really starting to um create a deficit in her ability to absorb her nutrient. So what I would do though is once you finish the leaky gut protocol, if you do, I would continue the gut seal homeopathic remedy. Keep doing that and keep doing liver tonic. So, but go back and I would really, really, really suggest you go back and watch the IBD webinar, and you'll probably get so much information that you can help your puppy with.
So I said that this would be the last one, but we have two questions here that I think you'll be very fast answering. So any recommendations for natural heartworm prevention?
So Dr. Ruth, oh my gosh, what's her name?
Roberts?
Dr. Ruth Roberts. Get onto her website. She has everything you want to know about heartworm. It's not just that simple. There's lots of, where do you live? How hot does it get? How hot does it stay that hot? There's a lot to heartworm, and she's really, really good at explaining it, much better than I am.
Here is the website, Veronica.
Oh, good.
Yes. And then Statia is asking, I was wondering about liver tonic. what part of the milk, I hate this word,
Thistle
sorry.
plant.
Thistle plant is used, and can we use the product long term? Thanks.
Yeah, and when we use, yes, you can use it long term, and I'm going to tell you why. Um, m- Liver tonic is a really, it's an interesting product. We have had, I can't even tell you the amount of people that we have calling in to speak about how their ALT levels were raised, and their liver enzymes were really high for the longest time, and they couldn't get them to decrease until they started using liver tonic, but it didn't start working for about 6 months, and then after 6 months of using it, they really started seeing the decline. It's almost formulated homeopathically. And it's one of the most, it's a very strong synergistic approach with the rest of the herbs as well, right? So it supports the pancreas, the liver, the kidneys, and the gallbladder. And when you use that energy to support all of those organs, it's kind of like they know how to um, get that whole area of that system functioning to its optimum. So you don't have to worry about it long term because the amounts in it are really low. The reason it works so incredibly well is because of the synergistic effect that they have with each other. And it's psilocybin. So, psilocybin. It's not psilocybin. God. Psilocybin is magic mushrooms. So it's like, oops, not psilocybin. It's milk thistle. The and the way we do it, we use the whole plant, and the way we do it is also very unique. I know, did someone say something with that? That's pretty funny. Uh, definitely not. Oh my God, that feels so. The so Cardus marianus is the um how I the way I look at milk thistle is very different than a lot of other people. So the Latin term for milk thistle is Cardus marianus, and it's very, very um it's kind of unique in the way that you use it. So if you were to go out and buy just straight milk thistle and use it, high milligrams of milk thistle, silymarum, yes, it is silymarum. Um, it's very different than when you use it in very dilute form along with these other ones. So please don't worry. You know, please don't worry about using it long term. I've got horses here that have been on it for 15 years. Not a problem. I had dogs with Cushing's on it for over 10 years at my practice. You don't have to worry about it long term at all.
Amazing. Okie dokie, I guess that's it. Because it's getting very late. I know that for some people it's like the middle of the afternoon, but for Julie and I, it's kind of 9:30, 9:34 now. So I have to wrap up the webinar, and because I'm sure Julie still has some things to do with the animals in the farm.
Lots to do
Yeah. And I know that we still have some questions here to be answered, and I totally understand how frustrating this can be. So for those who didn't get their question answered today, please join our community on Facebook, the Adored Beast Collective. They are amazing, and we have some of our own people there answering questions. So you can post your question there, and we will be glad to help you. You can also send, and maybe people will kill me for saying this, but you can also send questions to our customer successful team it's questions@adorbis.com. I would like to thank everyone who joined us today for your patience, your questions, and of course, you, Julie, for your time and valuable knowledge share. Any final words for us?
Yeah, it's really hard to get through this every single time. Sometimes I feel like I don't even want to do these anymore because I feel so bad that I can't get through them all. And so many are
Please send here in the chat if you don't want Julie doing this anymore, or if you do want her to keep doing it. Tell us now.
because I feel so bad, I feel bad that I can't get like there's so many difficult questions, and it's a really really tough job to try to get through some of these. Mariana and I, though, please know that Mariana and I had a meeting with customer service today and our HR person trying to figure out ways to be able to answer more of these questions somehow. So please don't think that it's like, oh, we don't care. We still have all of these questions because I just hate it. Uh, I hate like I'm looking at them right now, going, oh my God, like I just have to play. Maybe one night I'll just do an all-nighter. We can all drink coffee and
Oh my God.
we'll figure out a way to stay up till like 2 or 3 in the morning and see how many people are still down there, how many participants are still awake at 3. So yeah, we really are trying to figure out how to do this so that we can help some of these really, really difficult, frustrating little guys that people are at the end of their rope. So thank you so much. Hang in there, and we are trying in the background to figure this out.
Yes. And yeah, again, sorry. But like Julie said, we are trying our best, and we will come with a better solution for all the questions that are not answered. So that's it. I wish you all a great night, and remember to subscribe to our newsletter. You can sign up on our website to get all the information about Adorbees, our promotions, new blog postings, and future Ask Julie Anything sessions. You can also follow us in our social media channels, Facebook, Instagram, and TikTok. And that's it. Goodbye. Have a great night. Stay safe.
See you, everybody.
See you
Thank
next
you.
month. Bye.
Bye.